Education Week News gathered information from public school systems to discuss legal issues they may encounter when making decisions to reopen schools during the COVID-19 pandemic. As we know, children in the United States have a right to public school education. All children will be given equal education no matter race, ethnic background, religion, rich, poor, citizen, or non-citizen. A pandemic is a worldwide spread of new disease, typically affecting several countries, continents, and a large portion of the population. The World Health Order can declare a pandemic. During a pandemic, countries will try to contain the virus. If the virus is spreading, countries will move to mitigation, which is trying to slow the spread enough to keep hospitals from being overburdened. Non-pharmaceutical interventions are actions people and communities take to help slow the spread of a pandemic. School closures are considered a non-pharmaceutical intervention. States have the right to close schools due to public health emergencies. States, not school districts, are responsible for operating their public education systems and supporting those systems. Therefore, states cannot pass the buck to school districts to figure out how to respond to COVID-19, nor to have school districts shoulder the responsibility for continuing remote instruction. Public health officials also have the authority to close schools depending on whether an emergency has been declared, but they are not the ultimate authority in school closures. The federal government does not have the right to close schools. However, they do offer funding for educational programming, and schools must follow requirements to receive that funding. The CDC can offer guidance for school administrators, but does not have the authority to close schools. It urges schools to consult with local health officials before deciding to close or dismiss. There are pandemic preparedness plans to determine if schools exercise the appropriate standard of care in their policies and procedures before opening. National School Board Associations recently published a legal guide for school districts to review regarding the coronavirus and the reopening of schools. Past literature on school closures propose that closing schools during the midst of a pandemic may contribute to as much as a 15% reduction in cases and up to a 40% reduction in peaks. Typically, the order to close schools comes late in a pandemic curve, weeks if not days after deaths have mounted. Research has shown that 8 weeks of school closures to be effective in slowing the spread. Schools may experience claims of negligence or even recklessness from both parents and faculty. Insurance coverage for these claims may be excluded as they may be deemed related to the pandemic. Schools may enact policies to prevent older employees from returning to work or requiring them to work under different conditions. This also may lead to claims of unlawful treatment. Once a sick student or faculty has been identified, schools should be prepared to cooperate in a full contact tracing protocol in order to prevent a full-fledged outbreak. However, federal HIPAA law may come into play where a school is acting as a healthcare provider and may limit how the school can disclose an individual. Title IX claims may also rise. When considering what kind of autonomy to offer to faculty, being mindful of trends that could create different opportunities for male and female students. Schools will want to have a solid plan to strategize, stabilize, and mobilize as we move into uncharted waters of public school education and possible legal actions that will follow.